One of the ways that nurses there's lots of barriers, first of all, that nurses find with relating to kind of bringing up the topic of sexual health, such as embarrassment, I suppose. Lack of time is a big thing as well. In clinics, you don't always have the time to discuss with patients issues if they are brought up. But it's important that you acknowledge them, and perhaps you can give the patient a phone back and meet with them another time to discuss the issue of fertility or sexual health. And also lack of knowledge. So nurses and doctors alike aren't always particularly trained in bringing up this issue. And often you find that sexual health and intimacy is put at the back of all of the side effects for patients, but obviously it's very prominent and important for them. So there's different types of tools that nurses can use and models in order to bring up the topic. So one of the ones that I use is called the BETTER model. So B is like for bringing up the topic. So you could say, when you're educating a patient, for example, letrozole often causes vaginal dryness. Is this something that you've actually experienced? Or would you like any more information about this? And often you find that if you are going to open a conversation with the patient, they will open up to you, because nurses have that good innate trusting relationship with their patients. I suppose T within the BETTER model, so timing is everything. So if you are in a busy clinic, it's not always sometimes that appropriate environment. Again, as I said, to acknowledge that it can be an issue, but to point them towards particular resources that may be of help to them. So different websites can be helpful. So Macmillan Cancer Support and the Irish Cancer Society can be quite helpful. Obviously, giving a patient a leaflet if people feel that they're not maybe experienced enough to delve into that topic with the particular patient. And also there's patients can go to expressive group therapy as well, and there's often some trusts and hospitals have sexual health counsellors that patients can go to. And nurses would be surprised at the amount of patients that would avail of those services if those topics are broached with patients.